Hello all and good day and welcome to our webinar, Top Healthcare Trends, Ask Me Anything session. I'm your host, Dennis McLaughlin. I'm very pleased to have you spend a few minutes with us today and our experts. And without further ado, let me introduce our experts for the session today. Number one is our Chief Operating Officer, Matt Quinn from TIBCO. Number two, Nelson Petracek, our Chief Technology Officer. And last but certainly not least, Michael O'Connell, our Chief Analytics Officer. So welcome, panelists.
Welcome, Dennis.
Thank you, Dennis.
Thank you.
I had so many comments when you said last but not least about Michael O'Connell, but I realized that this is a public webinar and I should not do that.
That's only fair, Matt. Okay, so just to get the ball rolling, the concept of smart hospitals. You hear a lot about that today, and you hear the fact that folks mention smart hospitals, vendors talk about smart hospitals, but sometimes they're not speaking about the same thing. So what we'd like to do is go around the horn with the panelists and get an idea, what is TIBCO's view on smart hospitals and how do we see this evolving over time?
Well,
Matt,
maybe
let's start with you.
Yeah, I was going to say maybe I'll lead off. So I'm not going to address specifically what I think a smart hospital is. I'm going to let Michael and Nelson pontificate intelligently on that. But what I will do is I've watched the healthcare space, especially in the US, over the last few years, and it is really interesting. And we see these trends appearing in other parts, in other industries as well, where spaces kind of discover technology en masse. And so I think that healthcare for a long period of time, outside of kind of the insurance payer and payee space, was largely focused on larger infrastructure investments, building hospitals, right? Buying equipment to go into the hospitals. Technology, and specifically software, was often seen as a kind of a necessary but not sufficient component of their everyday life. But like we saw in retail, eventually kind of technology catches up, and it provides an advantage in terms of great care that we don't see before. So I think that's a little bit where what I'm seeing at the moment in terms of why smart hospitals and things like that have become much more important today versus what they were kind of 5 and 10 years ago.
Yeah, and just to add on to that, I think it's this digital network of that brings the data to the point of care and to the point of decision that's important in our view of things. It's and also the stakes are higher, right? The life and death versus just buying a better suit or whatever. So we've had some situations like connected hospital, smart hospital, like at the University of Chicago, where we've seen a reduction in cardiac arrests across the entire hospital, not just in cardio cases, because we're bringing data together from around the hospital and being able to monitor what's going on across the hospital network. So that sort of real-time alerts and understanding in our digital network what's going on in the different nooks and crannies of the hospital allows us to bring the power of real-time analytics to all parts of the hospital.
Yeah, no, and then just to add on to that, I mean, definitely the focus for a lot of the discussions around the smart hospital is around data. It's around digitalization. And usually I find that it's really related to 2 or 3 different core areas of the hospital itself. So when you're looking at the smart hospital, you're looking at things like operations. So that's anything from supply chains that are actually working with the hospital, as an example, all the way down to the operation of the building itself to make it much more efficient. You're looking at different clinical tasks. So what are the doctors, the nurses, the different staff at the hospital, what are the tasks that they are actually doing? And how can you make those tasks much more efficient to get them the information they need at the right time in order to help with decision-making? And then you're also looking at things like patient centricity. So what is and how can I better focus on the patient in order to derive and of course achieve greater patient outcomes? And so I find that when you're talking about the smart hospital, there's a lot of aspects to it. Data is at the core of each of these, but really as an organization, you need to be focused on all three. Some places will start at one of those, and that's where they kind of prioritize their initiatives. But inevitably, as you move along this journey towards becoming a smart hospital, I find that just generally speaking, you're really having to address each of those three areas.
So I'm gonna throw a small bomb into the conversation and bring up, since we've spoken about data, and by the way, everyone, this hasn't been practiced, but since we're talking about data, we have to kind of bring up kind of two pretty important topics, which is who owns the data, and if you are going to pursue kind of a smart hospital, the ownership and security, privacy of that data becomes pretty important. And then that falls directly into, what do you do with the data? What are and what can you do with the data that you're collecting? You know, clearly, artificial intelligence and other kind of techniques are becoming, the solution du jour to anything. But I think that when you think about it from a hospital point of view, from a patient care point of view, it does bring up some really interesting kind of cases where you want to be able to provide the best care possible, but with data privacy, what can you do and what should you do? And I think that, Michael, you made the point that retail, it's all about buying that new suit, and so it's a little bit different from life and death, and it absolutely is. And I think the stakes are then higher that we get kind of that side of it right. So sorry about that, Dennis. I know I kind of took us off, but Nelson mentioned data.
I did. It's my fault.
For sure. And bring the electronic health record is, in the hands of the patient too. I mean, if patients are going, for example, getting a pacemaker procedure, right? So they end up with a system that monitors their own data, monitors their data, that their vital signs or their, trends in symptoms or physical activity, and there now is options for them to upload that data under their control into the electronic health record. So then you get this kind of distributed set of data that's flowing around in that way, and if you can connect the electronic health record, medical record system, say in with the data in the operating room while someone's getting a procedure, so that you can understand risk while you're doing a procedure, and understand, say, probability of infection or sepsis in the operating room, informed by the electronic medical record, which is like maybe informed by the patient uploading their own data into the electronic health record. Now you've got this distributed data set that can really inform decisions made at the point of care. And then maybe the surgeon might want to do something extra for this patient in that procedure, for example.
Right. And I think that's a good segue, Michael, into my next question, my next overview question, which is around digital twin technology and its application in healthcare. It seems to have an impact, for everything from cost control to modeling clinical variability. So can you give some examples where you see the potential of this technology and how TIBCO can help our prospects and customers be more successful with it?
Yeah, for sure. And I know Nelson's done quite a bit of work in this area too. But if you think about the hospital operations themselves, and you've got certain loads of patients. I mean, COVID kind of brought this to the fore. Actually, when you've got you want to understand, say across a hospital network, what do you have in terms of empty beds, and what are you predicting in terms of empty beds, or in terms of like ICU capacity, or vents that are in use, or facility overruns. Especially if you've got multiple hospitals, how do you track that? How do you model that? How do you predict that at an operations level across the hospital? That I think is like a digital twin is really the intersection of IoT and AI, where IoT is, like the blood flow in the digital twin, and the AI part works in analyzing the data. And so you can sort of have the hospital operations and facilities and equipment and all of that. You can sort of model that, from an operations perspective, and get a handle on, especially in COVID times, where you've got gaps, and how you can fill that and shuffle things around to deal with predicted patient loads and so on. The Jacksonville Hospital at Baptist Hospital in Jackson, multiple hospital facility, and they've been overrun lately with COVID cases, and it's keeping a handle on that and predicting how to manage the flow of that is an important thing. But I'll turn it over to Nelson, because I know Nelson's been doing some work also on the patient as themselves as a digital twin type model, right, Nelson?
Yeah, no, that's right. I mean, I tend to look at digital twins. I bucket them into two big broad categories, if you will. There's the digital twins that are very much model centric. And so this is where you can take a bunch of data, and sorry, Matt, I'm going to mention data again, but if you take a bunch of data and actually throw it at a series of models in order to simulate a series of outcomes. And so your digital twin is trying to provide you with a, how do I better streamline operations at the hospital? How do I better manage where and how my staff are being deployed? How do I better manage the process and the overall care that a patient is receiving? But that tends to be more after the fact. It's a necessary element because, of course, I can tweak the digital twin much faster and much cheaper and at a lot less risk than I can actually doing this against a real live hospital person, whatever it happens to be. So there's definitely that aspect. The second element, though, their second characteristic of the digital twin is one that runs in parallel. And this is related to being able to create almost like a real-time image that represents some real-world entity. So, for example, we've been doing a lot of work around building and tracking patient journeys. And of course, where you start is you start with what have patients done in my hospital in this particular context. And so that gives you that understanding, that sort of core basis upon which you can build then the real-time digital twin of a patient. What is happening to my patient right now? How are sensors feeding into that digital twin of the patient? How do I want that digital model to respond? How do I actually use it to predict certain outcomes so that I can inject a certain level of care proactively? So you kind of have these different capabilities that digital twins can bring. And there's many types of digital twins. There's digital twins that you can get to be quite sophisticated, where you're building out a digital twin of the nervous system or the cardiovascular system, things like that, and running simulations against that. But in this particular context, and as it pertains to, again, our first topic, smart hospitals, you're building these models and either running simulations against those models or running these digital twins in real time to try and kind of monitor what is actually happening to, in this case, a patient as events are occurring right now, as opposed to after the fact.
Yeah, and it's those what if scenarios that I think have a lot of value. It's in COVID, it's like you kind of, well, what if this happens? What if this happens? And you can generate those simulations from, if you've got a decent digital twin model, so you can kind of understand what I might do if this situation eventuates. I think that's another big value of a future scenario type thing with a digital twin model.
Right, absolutely.
But guys, that's been kind of the shift with the digital twin versus what we saw before, which is the simulations, which used to be mostly based around kind of sampling and heavy on the math. Digital twin kind of brings a much more practical, almost dependency-based model to the simulation, right? You're simulating the, I use the word agent, but you're simulating the agent versus just simulating a math formula and hoping that it pulls out. And I think that those interdependencies and interplay between the digital twins yields just as much data as the digital twins themselves.
Oh, absolutely, Matt. That's really the core of the definition of the digital twin, is that if you can feed data from the field to the models and then tweak the models to improve the predictions and go back and forth, that really is kind of the core of how digital twin works. And I think I absolutely agree. That's where I think the innovation lately that's been occurring is the ability to go back and forth like that.
Plus, I never really got the math around constraint-based programming anyway. This is easier.